Hello and welcome to Healthy Lifestyle Tips. Today, we're going to talk about a topic that might make some of you squirm, but is important nonetheless: why men lose their testicles. The testicles, also known as gonads, are an important part of the male reproductive system. They produce testosterone, the male sex hormone, and sperm, which is necessary for reproduction. Losing one or both testicles can have serious consequences for a man's health and well-being. So, without further ado, let's dive into the top 5 reasons why men lose their testicles. 1. Testicular cancer. Testicular cancer is a type of cancer that occurs when cells in the testicles grow uncontrollably. It is one of the most common cancers in men between the ages of 15 and 35, although it can occur at any age. There are 2 main types of testicular cancer: seminoma and non-seminoma. Seminoma tend to grow slowly and are more responsive to radiation therapy, while non-seminoma grow more quickly and require chemotherapy for treatment. One of the primary risk factors for testicular cancer is having a family history of the disease. Men who have a father, brother, or other close relative who has had testicular cancer are at a higher risk of developing the disease themselves. In addition, men who have had an undescended testicle, a condition where one or both testicles fail to descend into the scrotum, are also at an increased risk of developing testicular cancer. Symptoms of testicular cancer may include a lump or swelling in the testicle, pain or discomfort in the testicle or scrotum, a feeling of heaviness in the scrotum, or a dull ache in the lower abdomen or groin. In some cases, testicular cancer may not cause any symptoms at all. Early detection is key to successful treatment of testicular cancer. Men should perform regular self-exams to check for any changes in the size, shape, or texture of their testicles. If any changes are detected, men should seek medical attention right away. A doctor can perform a physical exam, blood tests, and imaging tests, such as an ultrasound, to determine if a lump or swelling in the testicle is cancerous. Treatment for testicular cancer depends on the type and stage of the cancer. Surgery is typically the first step in treatment, and may involve removal of the affected testicle, called a radical orchiectomy. Radiation therapy or chemotherapy may be used to kill any remaining cancer cells. In some cases, a combination of treatments may be used. 2. Testicular torsion. Testicular torsion is a condition that occurs when the testicle twists around the spermatic cord, which is the tube that provides blood flow to the testicle. When the testicle twists, it can cut off the blood supply to the testicle, leading to a lack of oxygen and nutrients. This can cause the testicle to die if the blood supply is not restored promptly, and it can also lead to severe pain and swelling in the affected area. Testicular torsion is a medical emergency that requires immediate attention. It is more common in young boys and men under the age of 25, and it can happen spontaneously or after trauma to the scrotum. When testicular torsion occurs, the symptoms are usually sudden and severe. The most common symptom is severe pain in the testicle, which may also be accompanied by swelling, redness, and tenderness. Nausea and vomiting are also common symptoms, and the pain may radiate to the abdomen or groin. If you experience these symptoms, it is important to seek medical attention immediately. A doctor will perform a physical exam and may order imaging tests, such as an ultrasound, to diagnose testicular torsion. If the diagnosis is confirmed, emergency surgery is usually required to untwist the testicle and restore blood flow to the affected area. In some cases, the affected testicle may need to be removed if it has died or is at risk of dying. Prevention is the best way to avoid testicular torsion. Wearing protective gear, such as a cup, during contact sports can help reduce the risk of trauma to the scrotum. Additionally, if you have a family history of testicular torsion or have previously had the condition, it may be beneficial to undergo surgery to prevent future occurrences. 3. Trauma. When it comes to the risk of testicular trauma, some activities in sports are more likely to cause injuries than others. Contact sports, such as football, soccer, basketball, and hockey, put men at a higher risk of sustaining testicular injuries. Other activities, such as cycling, horseback riding, and martial arts, can also increase the risk of testicular trauma. Testicular trauma can cause a range of injuries, from minor bruises to severe damage that can lead to the loss of the affected testicle. Injuries can occur when the testicles are hit, kicked, or crushed. Some common types of testicular trauma include contusions. This is a type of bruise that occurs when the testicles are struck by a hard object, such as a ball or a fist. Contusions can cause pain and swelling, but usually don't result in permanent damage. Lacerations. This is a cut or tear in the testicle that can be caused by a sharp object or a strong impact. Lacerations can cause severe pain and bleeding and may require surgery to repair. Ruptures. This is a more serious type of injury that occurs when the testicle is crushed or torn. Ruptures can cause severe pain, swelling, and bleeding and can result in the loss of the affected testicle. Protective gear, such as a cup, can help prevent testicular trauma in contact sports and other activities where the testicles are at risk of being hit or kicked. A cup is a hard plastic shell that fits over the testicles and provides a barrier between the testicles and the impact. Cups come in different sizes and styles and can be purchased at most sporting goods stores. 4. Infection. Infections in the testicles can cause inflammation and damage to the testicles. Two common infections that affect the testicles are epididymitis and orchitis. Epididymitis is inflammation of the epididymis, which is a small coiled tube at the back of the testicle that stores and carries sperm. Orchitis is inflammation of the testicles. Both of these infections can be caused by bacteria, including sexually transmitted infections, STIs, such as chlamydia and gonorrhea. Epididymitis and orchitis can cause pain, swelling, and redness in the affected testicle, as well as fever and chills. In some cases, the infection can spread to other parts of the body, causing further complications. If left untreated, these infections can lead to the loss of the affected testicle. This is more likely to occur in cases where the infection is severe or has been present for a long time. Diagnosis of epididymitis and orchitis usually involves a physical exam, blood tests, and imaging tests such as an ultrasound. Treatment typically involves antibiotics to clear the infection. In some cases, pain medication may also be prescribed to help manage symptoms. Prevention of these infections involves practicing safe sex, such as using condoms, getting tested regularly for STIs, and avoiding sexual contact with partners who have an STI. It's also important to practice good hygiene, such as washing the genitals regularly and thoroughly, and avoiding sharing personal items such as towels or clothing. 5. Congenital defects. Congenital defects are abnormalities or malformations that are present at birth. When it comes to the testicles, there are several congenital defects that can affect their development and function. One of the most common congenital defects in men is undescended testicles, also known as cryptorchidism. Undescended testicles occur when one or both testicles fail to move down from the abdomen, where they form during fetal development, into the scrotum before birth. This condition affects about 1 in 100 male infants and is more common in premature babies. In most cases, the testicles will descend on their own within the first few months of life. However, if the testicles have not descended by the age of 6 months, surgery may be necessary to correct the defect. If left untreated, undescended testicles can lead to a variety of problems. For example, it can lead to infertility, as the temperature inside the body is too high for sperm production to occur normally. This can also increase the risk of testicular cancer, as the undescended testicle has a higher chance of developing cancer compared to a normal testicle. In addition to undescended testicles, other congenital defects can also affect the testicles. For example, some men may be born with testicles that are smaller than normal, a condition known as hypogonadism. This can affect the production of testosterone in sperm, leading to infertility and other health problems. In some cases, congenital defects may be genetic and run in families. For example, Klinefelter syndrome is a genetic disorder that affects the sex chromosomes and can result in the development of small testicles and reduced testosterone production. This can lead to a range of symptoms, including infertility, reduced muscle mass, and increased risk of osteoporosis. In conclusion, losing one or both testicles can have serious consequences for a man's health and well-being. The reasons for testicular loss can vary, from cancer to trauma to congenital defects. It's important to be aware of the symptoms and risk factors associated with testicular loss and to seek medical attention if you notice any changes in your testicles. And of course, prevention is key. Protecting your testicles during sports and other activities and performing regular self-exams can help reduce the risk of testicular loss. Thank you for watching. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel for more health and wellness tips. We'll see you next time on Healthy Lifestyle Tips.